Modern ECT is carefully controlled medical procedure performed under anesthesia, using precise electrical stimulation to treat severe mental health conditions. It is one of the most regulated and monitored treatments in psychiatry and continues to evolve as research advances. The public understanding of ECT is still shaped by stigma, fear, and inaccurate portrayals. Many people only know it from movies or outdated practices. This presentation aims to provide trauma sensitive, evidence based overview so healthcare professionals and public can better understand what ECT actually is today. Contemporary ECT uses precise dosing, continuous monitoring, and anesthesia to ensure safety and comfort. The electrical stimulation is brief and controlled, and the entire procedure is overseen by a trained team. This level of precision allows clinicians to tailor treatment to each patient's need. ECT is typically considered when someone has severe mental health conditions that hasn't responded to other treatments. This includes treatment-resistant depression, suicidal thoughts, catatonia, and certain mood disorders. It's not a first-line treatment, but can be essential when other options haven't worked. One reason that ECT remains so important is its availability to provide rapid symptom relief. In situations like acute catatonia or severe suicidal thoughts, waiting weeks for medications to work isn't always safe. ECT can stabilize patients quickly, which can be life-saving. Because many patients receiving ECT have experienced trauma or distress, trauma-sensitive care is essential. This includes clear communication, emotional support, and ensuring the patient feels safe and respected throughout the process. Ethical care goes beyond the procedure itself. Research consistently shows that ECT is highly effective for treatment-resistant mood disorders. Systematic reviews demonstrate strong outcomes across age groups, including adults and older adults. For many patients, ECT provides relief when nothing else has worked. Although used more cautiously in younger populations, ECT has shown significant benefits for adolescents with severe depression and suicidal thoughts. Studies indicate that many adolescents respond well, especially when symptoms are severe and other treatments have failed. ECT is sometimes compared to newer treatments like ketamine. While ketamine can be effective for some individuals, research shows that ECT can outperform it in certain cases of treatment-resistant depression. This highlights ECT's continued relevance in modern psychiatric care. Ethical care includes trauma-sensitive communication. Patients deserve clear, honest explanations about what ECT involves, what to expect, and what alternatives exist. Reducing fear and uncertainty helps patients feel empowered and respected throughout their treatment. It is important to emphasize expertise and accuracy when discussing ECT. Misinformation can harm patients by discouraging them from considering a treatment that might help. Clear, evidence-based communication is essential. ECT without consent is rare and typically limited to emergencies where a patient is unable to make decisions and is at immediate risk. These situations require strict legal and ethical justification. Consent remains a cornerstone of modern psychiatric practice. Stigma around ECT persists largely because of outdated portrayals and misunderstandings. Many people still imagine practices from decades ago, not the regulated evidence-based procedure used today. This stigma can prevent people from seeking effective treatment. Concerns about safety, memory, and patient autonomy often overshadow the reality of modern ECT. While no treatment is without risk, misconceptions can make ECT seem far more dangerous than it is. Education helps correct these misunderstandings. Evidence-based education empowers patients, families, and healthcare professionals to make informed decisions. When people understand what ECT truly involves, they can weigh its benefits and risks without fear or misinformation guiding the conversation. Like any medical procedure, ECT has risk. The most common are short-term memory issues and temporary effects related to anesthesia. These effects are usually transient, and patients are monitored closely throughout treatment to ensure safety. Safety is built into every step of ECT. Patients undergo medical evaluations beforehand, are continuously monitored during the procedure, and receive follow-up assessments to track progress. These protocols help ensure that treatment is both safe and effective. Recent years have seen increased use of ECT in adolescents with severe treatment-resistant depression. As research grows, clinical acceptance has expanded, and more providers recognize ECT as a valuable option when other treatments fail. International discussions emphasize the need for factual, non-politicized conversations about ECT. Different countries have different practices, but global consensus is clear. ECT can be safe and effective when used appropriately and ethically. Modern ECT is evidence-based, regulated, and trauma-sensitive. For individuals with severe mental illness, especially when other treatments haven't worked, it can be truly life-saving. Understanding the facts help reduce stigma and ensures patients receive compassionate, informed care. Thank you.